Hi, my name is Gina Moret and today we will be scanning the mandible and the chin of my patient. So the first thing that you have to do is find the bone. In order to have a good grip of your transducer, you have to hold it with this little part outwards, and you can give some support with your other fingers to stabilize the probe, and you can find the hyperechoic on the bottom of the screen, a hyperechoic linear structure, which is the bone, the mandible bone. And right, if you continue very slowly movements upwards, you can see the parotid gland, which is this blurry area, a little bit of a blurry area, like it looks like a cloud, on top of the masseter muscle, laying right on top of the masseter muscle. That starts from here on the lateral preauricular area of the face. Now, we saw the bone and the parotid gland. So I'm gonna show you now a little maneuver that can help you find all the muscles that you wanna find with the ultrasound. So we'll make the patient move that muscle. So can you clench your teeth, please? There you go. You can see this hypoechoic structure getting bigger. Now relax, and now smaller. That's the masseter muscle, which in this patient is a little bit hypertrophic. And when she clenches her teeth again, you can see little tiny white lines inside. Those are the fibers, the ligaments, even the fascia of the muscle. Let's continue moving on to a little bit right before the masseter muscle. You can find the facial artery and vein. In order to use the ultrasound to see them better, what we do is we change from the beam mode to the color Doppler mode. You can fix the box here the way you want, the area that you want it to focus on. And with your scanner, you can right there and then find the vessel. Normally the arteries are not collapsible, and the veins, when you push against, they collapse. So there you go, facial artery. Continue a little bit forward. Let me put a little bit more gel. Gel is very important. Without enough gel, you cannot see well. So you have to use the gel to let the sound waves pass through the surface of the skin. So when I enter into the first third of our mandible, we can see some important structures. And again, it's a muscle. I want to check out now the DAO, the depressor angularis. Can you please do this, my dear? Yes, wonderful. Let me change from color Doppler to beam mode again. And there you go, relax. Do it again, there you go. Do you see this little oval shaped hypoechoic area that gets bigger when she moves? Now relax, and smaller again. That's the DAO, the depressor angularis. Moving a little bit forward, we are gonna go to the tip of the chin. As you can see, the very shiny, bright, hyperechoic line, it's the mandible, and right next to it, you can see, look, I'm gonna put right in the middle of the screen, a triangular, oval-shaped hypoechoic area here and here. On both sides, they are the mentalis muscle. Now let's ask her to move the mentalis. Can you do this for me? Yes. Can you see the hypoechoic area getting bigger and smaller according to her movements? So these are structures that are very important when you are scanning the mandibular area. And here my video finishes. Bye bye. Thank you so much.